Hello, my name is James Rosone. I'm a thriller and science fiction writer, and I wanted to take a moment to just talk with you guys about some of my own experiences with PTSD and some of the therapies that I've been pursuing and what has worked and what hasn't worked. I've been pretty honest and straightforward with you guys on some of the therapies that I've pursued and what has worked and what hasn't worked. And I want to share those experiences with you because maybe it'll help some of you guys, maybe it won't. But I think by putting some of that information out there for you guys, maybe it will lead to someone trying something new that changes their life. Maybe it doesn't, I don't know, but it certainly can't hurt, right? So I've tried a lot of methods with the VA, from the cognitive processing therapy, the CPT to EMDR. One of the things I found that worked the best was the stellate ganglion block injections, or the SGB injections, where they do those in the neck. I talked about those before with, how Dakota Myers did that. And I've done a video on that as well. And I did a special with Tampa Bay's Fox 13 on that with one of the local doctors here in Tampa. That's very effective. That's really, really helpful and effective, actually, with dealing with the body's physical response to PTSD. Because when the brain is triggered, it sends a neurological response down through the neck, down to the heart to trigger the heart, and it causes the body to, go into fight or flight, right? And the SGB injection is a block, and it blocks that from happening. So it doesn't address the mind, so you're still going to have that triggering effect, but it blocks the body from having the effect. So that's why the SGB is a very effective means of helping the body. However, ketamine is actually very effective with helping to address and deal with the mind. Now, I hadn't heard of ketamine for PTSD or anxiety and dealing with or depression, things like that before. One of my other author friends, Jason Casper, had used it, and he talked about it in a podcast. And then I talked with him about it and learned more about it, researched it a little bit. And then I found a doctor here in Tampa who did it. And I talked with him about it, and I can share some more information with you guys about how that worked with him. I'm actually going to share that with you guys here. I want to share that, what that looked like. So the doctor I talked with, his name is Dr. Arun Kalava here in Tampa, out of here, and he does the ketamine. He also does it for pain management as well, but he does it for PTSD. And I'll tell you what, that has been incredible. The treatment's just been phenomenal for the PTSD. It's just really, really helpful. It really, really does make a difference. I thought it was very helpful. Here's the episode. We talked about it. You see me getting it done. You can watch it being done on me and see what it's like. It's very quick. It's very easy. It doesn't take very long. It does not hurt, much to a lot of people's surprise. It's not going to hurt. So it's a lot easier to have done than you would think. So this is for the SGB injection. Now, he also does the ketamine. Now, I would recommend doing both, because what you do is you do an SGB injection first, and then I would recommend doing a ketamine next. So when I did the ketamine with Dr. Kalava, is we first did, you do an SGB, and then you do 6 treatments of ketamine. So you do Monday, Wednesday, Friday, and then the next week it's Monday, Wednesday, Friday. And basically what he does is you're going, they hit you with the ketamine, you're basically under for about 20 minutes for the ketamine. And what he'll do is They do it through IV, through intravenously. So he's going to give you a benzodiazepine first, which is kind of a happy drug, essentially. You're just going to be like happy as heck. And then very quickly after that, he gives you the ketamine, and you're done. That ketamine, when that ketamine hits you, man, you are transported to another dimension. I mean, you're down for the count. It's so hard to explain what a ketamine trip is like in words, which is odd because I'm an author and I tell stories for a living. But trying to explain ketamine, what it is like. So I'll do my best, okay? I don't know if you've seen the movie Inception and The Matrix. So a ketamine trip is very similar to the movie Inception and The Matrix. It's like Inception in that you're in a dream, inside a dream, inside a dream. You sometimes fall inside of one dream, inside of another dream, inside of another dream. But it's like the Matrix in that sometimes you don't know what's real and you don't know what's fake. And these dreams are incredibly real. I mean, we swear to God, these things are real until they're not. And that can be kind of unsettling and scary a little bit at times too. Now, I'll say with Dr. Clava's treatment, it was much less unnerving because of the benzodiazepine they gave you. But those were also very short treatments. Now, I've gone on to use the oral ketamine, which I used with this company here, which is also through another doctor here. So with this other doctor here. And he's also out of Florida down in Miami. And they work with a compounding company, and they mail you the drug and send it to you here at your house, and you take it here at home. And they work with you dose up slowly, basically. And there's a distinct difference between oral ketamine and intravenous ketamine. IV ketamine is instant, hits you right off the bat. Oral ketamine, it's a lot slower. It takes about 12 to 15 minutes for it to affect and hit you, but it lasts longer. Like oral ketamine will probably hit me for about, it lasts for maybe probably more like about an hour and 20 minutes, whereas the IV is about 20 minutes. The oral ketamine, when you kind of wake up and you start to come out of it though, that takes you probably about an hour and a half to 3 hours to kind of fully come out of it though, like before you're really like out of it. Whereas with the IV ketamine, you're essentially out of it in about an hour. You're back to normal, so to speak. So there's a distinct difference. The oral ketamine is much cheaper. I'll be frank, it is cheaper than doing the IV ketamine. But I think it's also a significantly higher dose. So the IV ketamine, we started at like 30 milligrams and got up to 90 milligrams. Whereas with the oral ketamine, you start out at 75 milligrams, and then we leveled out at 450 milligrams. And now I just do like a maintenance dose with that, kind of as needed. I think I'm probably doing a 450 milligram dose maybe once every 10 to 14 days. And I'm really doing that because honestly, it's helping me with some of the chronic pain. I've unfortunately just got long-term chronic pain. I've got a lot of bone pain and nerve pain. When I was in Iraq, unfortunately, I had a lot of chemical exposure. I worked in intelligence, and so my job was interrogating terrorists, and we had to burn class 5 materials. And You know, it was a relief for us when we're interrogating people, we we're doing that. And so we're burning, lithium batteries and laptops and all kinds of stuff you're not supposed to burn, and just other kind of garbage we're just exposed to. And, um, you know, breathing all those kinds of toxins and stuff that causes problems for the body. And I was 30 years old and developed vascular necrosis of both my hips, and 31 and had my hips replaced, and my hip bones and my femur are kind of falling apart on me. And I've got, 16 or 18 inches worth of metal holding my hip bone and my femur together. And just, it hurts. It's just a lot of bone pain to hold everything together. And, I've had 4 hip surgeries, and at this point, the VA can't really do anything for me. They've said all they can do is, try to do another surgery to see if they can try to fix more. But at the end of the day, they say there's nothing they can't guarantee they can make it better. Um, and, I've been using opioids for like 12 years. So I've been trying a lot of different things to try to work with the pain, work on dealing with this chronic pain. And I think ketamine might be one of the solutions, in addition to the opioids, at least to help me from having to be on such a high dose of opioids. It's a problem, it sucks. You gotta have some kind of quality of life issue you're dealing with at this point. Do you not take anything? I mean, I can not take any opioids, but then my quality of life is crap. I'm 43 years old. I have a 2-year-old, a 6-year-old, and an 8-year-old. I'd like to be able to play with my kids. I'd like to be able to go outside and go do things with my kids and be active with them. But I freaking hurt like hell with when I'm active and doing things with them, because of all of the bone damage and the nerve pain. It just hurts. So I got to do something. I got to take something to try to curb that stuff. And, the opioids just, they don't take away the pain. Nothing's going to take away the pain. All it does is just help deaden it. So I can at least be active with my kids and do something with them. But honestly, the ketamine has done 2 things for me. It's helped me come off of 75% of my PTSD medication, and it's helped reduce my dependency on opioids by like 50%. And for me, I think that's huge. I think that's been big. So if that can help you, or you think that might be advantageous or helpful for you, then by all means try it. At the end of the day, what more do you have to lose? If you've been struggling with PTSD or anxiety or depression, why not try it? I mean, I know you got to be tired of taking Lexapro or Xanax or some of the other medications. The side effects of those things suck. I know, I've been on them for years, decades. It sucks. If you're on opioids, I know you're tired of going to the pharmacist and dealing with the pharmacies, how they look at us like drug addicts just because we want to have a reasonable quality of life. And wondering, are we going to be able to get our prescription refilled this month or not? I deal with that too. And if this can help reduce that dependency, it's worth it, right? And this is legal. We're not doing anything illegal. These are board certified doctors. This is medication that's got decades of scientific study and research behind it. It works. It just may not have been well known or talked about. So I say, why not try it? If it can help you, that's what it's all about. So why not give it a try? Again, if you've got questions about any of this stuff, feel free to ask me. You can always email me. I'm usually pretty easy to get in touch with via email. james.rosone@gmail.com. I'm pretty easy to get in touch with via there or on Facebook. So if you have questions, feel free to ping me about it. But definitely give them a try, check them out. But again, if you're looking at this thing from a PTSD angle, I'm telling you the way to tackle this issue, do the SGB first, do the ketamine, and then follow it up with a final SGB. How you hit the right side and the left side, and then you do the ketamine. That way you hit the both sides in the ketamine, and that should really kind of hit it. And then you may need to do a maintenance every now and then, like you say, once a year, once every 18 months, or every 2 years, whatever. You're not going to remove it. You're never going to remove it, but you're going to significantly reduce the impacts of the PTSD. At least the SGB will help with that. The ketamine may help to remove the PTSD, or it may help with rewiring some of the neuroreceptors and pathways in the brain. And if anything else, it's certainly going to help make the counseling to deal with those symptoms a hell of a lot easier to manage and go through, and help you get through it once you've done those treatments. So again, address the issues, deal with it now. You don't want to go through and waste another 5, 10, 20, or 30 more years of your life struggling with PTSD or these things like that. Not when there's solutions out here like this that can help you with that. So you have questions, let me know. Otherwise, I wish you all a good day, and I'll talk with you later. All right, bye.